Good morning. Today is November 7, 2020, Saturday, 9:30 in the morning in United States, Eastern Time Zone. Today is our scheduled yoga therapy class through Sattik Space Yoga and Healing Studio. For our international audience, I forgot to mention that last Sunday we have a change in our time. Here in United States, we go through a daylight saving time and a standard time. And the way to remember it is that during fall time, we say fall back, and during springtime, we say spring forward. Like in fall time, our clock turns back 1 hour. So, for all practical purposes, this is around 10:30 in our Eastern Time Zone in the United States, and the correspondingly all of your time will change. So since it is 9:30 now, all of your time has moved 1 hour ahead because you don't change. This will be all for even audience from participants from India, Bangladesh, European and South American countries. By next weekend, we'll be all normal time zone, and I will inform it through my Facebook posting. Today's topic is all healthy life and living is a yoga therapy. And I will be giving you a little bit of an idea, and then I will give you the practices which we need to be healthy and enjoying a good quality life. Any practice of yoga is going to create two physiological changes in our body. First change is the treatment of a disease. If you have underlying chronic disease, this is a relaxation response, activation of parasympathetic tone. It is going to overcome and correct any chronic lifestyle related disorders. Yoga is a lifestyle medicine. Treatment of a disease, then it says maintenance of health. In Sanskrit, treatment of disease called roger chikitsha, and maintenance of health is called shastha rokha. This maintenance of health gives you the healthy life and living. As you all know, the yoga therapy is an adaptation of the yoga practices. Yoga practice is a philosophy, 196 small aphorisms called sutras, of which 193 is to quieting down our mind. Practice is called 8 limbs of yoga, and it is a stepwise practice. Yam, social restraint; niyam, personal restraint; asana, the physical posture; pranayama, voluntary regulation of breathing; pratyahara, control of your 5 senses; dharan is the focus; dhyan is the meditation; samadhi is the union of body, mind and spirit. All leads to, at the end is a meditation, and we always say meditation is the medication. Very interesting, both the word meditation and medication derived from the Latin word medere. Physicians, they come from the Latin word medicus. In a yoga therapy, this is also got your influence by a lot of other practices, like called mudras, the hand gestures, we call health in your hand, bandhas, root lock, it's called the lock, root lock, abdominal lock, chin lock, and the great locks. The powerful activation of relaxation responses. Kriyas is called cleansing, literally physical cleansing of our physical body. Tratak for your eyes, Nasya to clean your nose, Dhoti cleaning up your stomach, Kapalbhati, very fast, rapid, your breathing technique, your active exhalation, passive inhalation. Nauli is your abdominal lock. It's called Uddiyaniban, breathing out completely, sucking your stomach in, then isolating the rectus muscle, the muscle on the both sides, which you call the six packs, isolating and moving it side to side, massaging the abdominal content. And a basti is your enema to cleanse your colon. These are physically you clean from outside and inside of your whole body, and this is also a part of very cleansing process. Ayurveda, Ayu means longevity, Veda means knowledge. It's a principle in philosophy which also get integrated with yoga, part of yoga therapy. Then comes the daily routine. This is called dinacharya, when to get up, what to do throughout the whole day, when to eat, how to eat, when to sleep. Daily routine, dinacharya. I have the whole session on that, and they're all uploaded on my YouTube channel. You'll be able to access it. And finally, it's a lifestyle. Yoga therapy is a lifestyle medicine. So what keeps you healthy? What gives you quality of life? It's very simple. First, in yogic definition, health is a balance of your body, mind, and spirit. So, throughout the whole day, 24 hours a day, 7 days a week, 365 days a year, you are going to maintain a balance of your physical body, balance of your mind, balance of your whole daily activities. Getting up in a step, put your right foot first, then the left, right, left. Don't go up, right foot, right foot, right foot. Because we're all either right-handed or left-handed. Going down the steps, right foot first, then the left. Walking, right foot first, left foot second. Always in the balance. Anything you can do, cleaning up your, say, countertop with the right hand, use your left hand to use. Balancing. Read a newspaper holding like this, try holding it the other hand. Brush your teeth with the left hand. We call ambidextrous. That's your balance. Keep back of your mind. Thought process. What is the balanced thought process? In yogic definition, it's called non-dualistic. Whole Western philosophy is dualistic. Right, wrong, black, white, day, night. Yoga philosophy is non-dualistic. There's no black and white. You live in present. You accept things as is. That's your healthy living. That gives you quality of life. The moment you have a judgment, did you get it? Chattering of your mind. It's called chitta vritti. Chattering of your mind is a sympathetic response. Gets your blood pressure up, heart rate up, respiratory rate up, blood sugar up, muscle contracts, fight and flight response. That is the most ill health we can ever have. So balance of your body, mind and spirit, defined as a health. Next, health, and to maintain a health is the 3 pillars in yoga. First, strong digestion. Strong digestion, easy elimination, and good night, dreamless sleep. The moment you have a dream in your sleep, that sleep is not deep enough. Sleep has 2 types called REM, rapid eye movement, and non-REM, non-rapid eye movement. There is stage 1, stage 2, stage 3, stage 4. You need to have stage 3 and stage 4 of the sleep for proper healing of your body and mind. So we'll do a practice. What are the practices for strong digestion? What are the practices for easy elimination? What are the practices for your a good dreamless sleep? Proper digestion comes from activation of parasympathetic tone. Our whole digestive tract, from mouth up to your anal canal, is supplied by parasympathetic nerve. So the Western concept of food as a calorie, keep burning, you will be digesting this food. Yogic concept is no, it's a parasympathetic activation. Food first converts into our different body tissue, plasma, red blood cell, muscle, fat, bones, nervous tissue, reproductive tissue. Then it forms a substance called ojas, which is our immunity of our body. Then it has some extra glucose, which provides energy, which is called aerobic glycolysis. If the food is not properly digested, you feel within yourself introspection. First one is called heaviness in your body and mind. Lightness of your body and mind after food, the food is properly digested. Smell in your excreta. If your urine, your stool, your perspiration smells, that food was not properly digested. Appropriate natural urges. We have 13 natural urges. Blinking, sneezing, coughing, vomiting. We have the whole list of 13 natural urges. It's very natural. Appropriate hunger and thirst. Many people say, I'm always hungry after I eat. Our brain cannot separate between thirst and a hunger. So when you feel hungry, drink little water. If that hunger doesn't go away, that probably is a real hunger. It's not from the thirst. There's a lot of other signs of proper digestion, which will come slowly and slowly. Proper elimination. You'll wake up in the morning, you'll sit down in a squatting pose, drink a glass of water with a gulp. Drink a gulp. It will start, we call gastrocolic reflex, and we'll have a proper elimination in the morning. If you don't have it, after water, you do a practice. It's called, Sanskrit name is called a Loghu Shankha Prakshalan. Loghu is your mind, Shankha is your intestine, Prakshalan is a cleansing. 5 asanas, and we practice those 5 asanas. When you have a proper bowel movement, proper urinary output, it should be like called effortless ease. The moment you put in effort, the moment you start straining, that is not a sign of health. Sign of health, able to sit down in a squatting pose and able to get up without a support. Sign of health, able to balance. Able to balance with your eyes closed. We'll do the practices. We have done it before, we'll do it again. You'll see it. Sign of health is able to take a completely breathe out of the contents of your lung, able to take a deep breath in effortlessly and breathe out longer than breathing in, and that is your normal breathing cycle even when you are sleeping. Sign of health is a hand grip, hand power. You'll be able to put your hand, raise your whole body high up, called raising asana, Tulasana. Let's start. First, if you're sitting in a chair, you can sit in a chair and start doing your practices. Relaxation practice. Say, I put my feet, both feet underneath my knees, keep my spine straight. The first sign of being healthy, first sign to enjoy a good quality life is spine straight. Always when you're standing up, you will be thinking about your ear, your shoulder, your hip, and in the ankle in the same line. That will be your body's posture. Called Jashthyasana, Dandasana. Basically, your body should be like a stick. Sit down. You sit on a chair. Anywhere you sit down, keep your spine straight. The moment you can sit down very comfortably, be sure there is no pain. If there is a pain, you back off. And able to breathe effortlessly. First yogic breathing is breathing out. Breathe out first. Take a deep breath in. Then able to breathe out effortlessly longer than breathing in. And the moment you start doing it, you'll see this thing is going to happen. When this thing happens, you change and see you're activating both sides, bringing the balance back. So bring the balance back and see how you feel. One side will be easier than the other side. Use a hand as a relaxer. It's like close your hand like a baby. Balu mushti mudra, adhi mudra. Take your thumb, put inside and close. That's the way baby closes the hand all the time. Do it your breathing. Breathe out first. If you're doing it with me, let's start the practice. Breathe out first. Then take a deep breath in and close your hand like a baby. That's the way baby closes their hand. Baby never closes the hand like this. Why? Baby is pretty relaxed. Breathe. And the hand gets relaxed like this. So you can do both all the same time. Breathe in. Breathe out. Wrist gets relaxed. Breathe in. Breathe out. Breathe in. Breathe out. You can always do a fist. Breathe in. Just rotate. Rotate one way, rotate other way. You will feel the difference and you will feel the sign of health and healing. So, once you are like that, you can always slowly get your feet high up. This is called your half lotus or Padmasana. Can you sit down here? Put your one hand, take your fingers, put your fingers through your toes. So when you put it through your toes, your feet get relaxed. The moment you get a relaxation response, your breathing becomes effortless. Normal breathing, what you do to be proper, healthy, is breathing out longer than breathing in. But you always incorporate a breath during your daily practice. This is your daily practice. You're sitting down with a relaxing asana called half lotus with your hands, fingers separating your toes. And now we incorporate your very slow and gentle Bastrika Pranayama. And then you progress. Bastrika Pranayama, Bastrika is a bellows, is an active inhalation, active exhalation. We have done it before, because I have all of them in my yoga practices in YouTube channel, you can see. So gentle Bastrika will be taking a deep breath in, 2.5 seconds in, 2.5 seconds out, actively. People always ask me, how long should I do? There is no time limit. You do it only when you can do effortlessly. Like by the end of the practice, your breathing should be normal, you'll be able to breathe, you'll be able to talk. Initially it could be 30 seconds, good enough. Slowly and slowly, you start having a little bit of a faster pace. And you see when you go faster pace, your body becomes healthier and healthier. Bastrika is called Prano Pradhan Pranayama. Prano Pradhan means Pran is a life force. It is a subtle energy which comes to your body, which keeps us awake, alert and alive. So this bellows breathing brings the prana in our body. Basically, it removes all the dirty carbon dioxide, all the volatile substance, bring more fresh oxygen here. So in a comfortable practicing like that, which may take little time, and for the beginners, it's called neuroplasticity, habit forming. It might take about 2, 4, 6 weeks. Generally, we say between 20 to 40 inputs in your brain converts the neuroplasticity. Like I'm sitting like this, I'm not trying, my brain is allowing me to sit like this. Next, in the same posture, what you'll do, I'm just giving you a little sample. But I practice it every day, and the way I practice until my level of my breath. When I feel my breath is going to have any effort, I stop. With my eyes closed. Next one, I'll be a little faster like this. We do in the morning a jalneti, we wash our nose, and you get some little drainage comes out, is entirely normal. You feel the effect of relaxation, what you can do, now we can change. You can change your feet. Now I'm putting my right foot on the top, and if you're doing it with me, see if you can try. You'll see one side will be a lot easier than the other side. And for all the very long-term practitioners, you know what I'm talking about. I can get into my lotus pose very easily. But I'm taking my steps. I'm taking my steps, and the word I use in stages, impossible become possible. When you hold the asana for a longer time, initially muscle and ligament contracts, and slowly a relaxation takes place. Before relaxation, you'll feel a little bit of fasciculation of the muscle, then you get a profound relaxation. To add that, you bring more oxygen in. Oxygen is a powerful relaxer. If you have a back pain is due to tightness of your back muscles, irritation of a nerve from your herniated disc, from your spinal stenosis. But the back pain happens because it irritates the nerve and the muscles become very tight. Simple technique is put a heating pad. The moment you put a heating pad, it opens up your blood vessels, called vasodilatation. Brings more oxygen in. So let's bring more oxygen and see in stages. We're doing pranayama in stages. You won't be able to do what I'm doing it now, or maybe able to do because you've been doing it for a long time, but when you do it, it will be completely effortlessly. Let's do a little faster pranayama. Faster Bastrika Pranayama, which exactly in a sign of health. Eyes are closed. I'm going to do rapid Bastrika Pranayama without any effort. I did 200 of them. Very easy. I'm still talking, still breathing, even I'm singing. I can easily do 500, 600, because I'm doing it for a longer time. But you have some effect in your body and mind. This is called a Hyperventilation Syndrome. You feel your body is going to get warm. I feel the warmth in my body. So after this, your breathing gets a lot deeper. You breathe out for a long time. Take a deep breath in. This is called a 3 stages breathing. Breathe, you fill up lower part of the lung, almost comes down your belly button, middle part of the lung, chest opens up, upper part of the lung, a clavicle rises. Your collarbone rises. So you will feel it when you breathe out, a long breathing out. You'll be able to see if you put a hand around your chest, if you tighten up your abdomen, when you breathe out first, and when you take a deep breath in, you'll see the separation of the expansion of your chest. Now, also you'll have some effect, warmth in the body. You have a little circummoral numbness. You can feel some numbness around it. We call it carpopedal spasm. You can have a little spasm in your hand and feet. Altered level of consciousness. What it does, it causes a constriction of blood vessel going to the brain. So your intracerebral pressure pressure within your brain, it goes down. You have a little bit of altered sense of consciousness. You might feel a little bit of a dizzy. You might feel that you have been moving around. You can feel you're crawling your body. A lot of sensory symptoms is entirely normal. This is called hyperventilation syndrome. In fact, we used to remember in our medical practice when a patient comes, a neurosurgeon did a surgery or had a head trauma, he had a high intracranial pressure. So remember, between the brain and the skull, there is a little fluid called cerebrospinal fluid. When the intracranial pressure goes high up, we used to have the anesthesiologist intubate the patient, put them on respirator, and do the hyperventilation with a breathing machine to reduce the pressure in the intracranial pressure. There's a lot of physiology behind it. Connection of your whole pulmonary function with your heart function, brain function, and cellular function. Now I'm comfortable enough. I can go ahead and put my feet high up. I'm easily comfortable in lotus pose. By the time you're able to do a lotus pose, you're able to sit down like this, you have a smile in your face. Your breathing is better. You feel a profound level of relaxation. You feel a good quality of life and living. And so very interesting is it shows up in your day-to-day activity. You will have a little bit of, we call it your aura around your face. We call it a tejas. If you see the face, you will see people will see one glowing. The face will be glowing. It's your tejas. Prana, teja, and ojas. Prana is the life force. Teja is your fire within you, called igniting your fire. Ojas is your immunity. You can incorporate your breathing technique. Just a moment. You can do your breathing technique and the Bastrika. You can do the Bastrika with all the physical movement. And when you do it, like if you're doing a sit-ups, you'll be taking deep breath in and out, like even here. But in a yoga therapy, you will balance. And this is the practice I want you to do. If you're doing it with me, see if you can do it. Sitting in a chair is good enough. Sitting in a ground is best. But I cannot sit down in the ground? Yeah, start with the chair. And I can guarantee you, in a very short time, you'll be able to sit down in the ground and do it. I have so many people. I do a class for Parkinson's disease. People come with Parkinson, they sit down in a chair, slowly. They have a mat in front, they're sitting in a mat and doing the practice. I ask them what happened. They don't even recollect. They came down from the chair to the ground. So the moment person says, I cannot do it, my answer is, your mind cannot do it. I'm not flexible enough, your mind is not flexible enough. So this is the concept. If you breathe out here and breathe in, then we'll be doing your breathe out here and a breathe in. Or if you breathe in here and breathe out, then we'll do breathe in here and breathe out. Let's show you one sample so you'll understand what we're talking about. We'll be breathing in, breathing out, like this. You can continue as long as the breath is effortless. Again, How to check the effortless breath? You can talk. You can even sing. The moment you're huffing and puffing, that breathing is not going to help you. That breathing is not going to be part of your healthy living in life. So now, remember, we did breathe in here and breathe out. So, what we'll be doing, breathing in here and breathing out in the front. When I practice, generally, I really don't count, because when my mind is in my body movement, my count is not there, because I'll be counting maybe 50 on either side. So understanding the concept, the balancing on both sides, that is your health, that is your healthy living. So let's do another way. By the time you're able to do a Bastrika Pranayama, this Bastrika is the gateway of Pranayama. Pranayama, voluntary regulated breathing. It is not a breathing exercise. You're not doing a breathing exercise. Breathing is both involuntary and voluntary. I'm sleeping, I'm breathing. That is a function of my brain stem. I'm awake. I can take a deep breath in and breathe out, the function of my cortex. Unconscious to the conscious. So breath is a connector between your body and mind. I always give this metaphor and people love it, so I give it again. Flying a kite. The roller is your body, kite is your mind, and the thread is your breath. Breath connects your roller and the kite. So if you're doing it from the front, same concept. Look at what the balancing concept is. This is the yoga therapy. First breathe out, and take a breathe in and breathe out. Breathe in, breathe out. Breathe in, breathe out. Now what you'll do? You will do breathe in here and then breathe out. So do breathe in, feel a tremendous amount of energy in your body. Why? This is simple high school chemistry. Aerobic glycolysis. Glucose combines with oxygen, forms carbon dioxide, water, and ATP. ATP is adenosine triphosphate. That's your energy. Carbon dioxide comes out through your lung. Water comes out through your kidney. You feel a profound level of energy with the ATP. If you don't have enough oxygen in the body, you develop called anaerobic glycolysis. Glucose with not enough oxygen forms lactic acid, pyruvic acid, pain-producing substances, not enough ATP. This lactic acid, pyruvic acid, pain-producing substance make your life miserable. You don't feel healthy at all. So, Another practice we do in a Bastrika Pranayama, I'm showing the different technique because this is a sign of your health and healing and healthy living. We'll do it a hand raising, hand up. We'll do very slow pace, medium pace, fast pace. We'll do 20 slow, 20 medium, 20 fast. Do one cycle. Then repeat the cycle. How many cycle? Up to you. 2, 3, 4 cycles you can do, but effortless. Remember, all the disease, if you spell it, D-I-S, dis, space, E-A-S-E. When your is become dis, it's a disease. What is the therapy? Effortless ease. Your effortless ease is your therapy. Let me show you one sample of your, again, very rapid Bastrika Pranayama, completely effortlessly, one cycle, but generally we practice a lot of cycles. You'll be doing with the eyes closed, with a smile in your face. If you don't practice yoga with a smile in your face, your relaxation response and parasympathetic activation has not taken place. Slow 20, medium 20, and the very fast 20. Breathe in, breathe out, you do a yogic fist called Adhi Mudra or Balu Mushti Mudra, baby fist. Thumb inside and close. If you're doing with me, you can do with me, and you can start now. 20, slow. 20 at a medium pace. In a very fast pace. Wonderful practice. Sign of health and healing. You'll be amazed when you have a good quality life, you enjoy everything in nature. You become grounded. You become grounded with nature. I just posted some picture of our trip to Brazil in my Facebook, and I get so many comments. But that's our life, living. It's quality life in living. Hand grip, both hand grip, is an extremely important physiological marker. We can test our hand grip. Few of the researchers have shown with the strength in the hand grip, you can make a diagnosis of the chronic lifestyle related disorders, including diabetes, hypertension, coronary artery disease, just simply measuring the hand grips. It's amazing. So hand strength, extremely important for quality life. Let's show you what yoga has taught us. Kukutasana. You can do Kukutasana, put your hand in between, but also before Tolasana, raising. Put your hands on both sides. When you're relaxed, what happens? Breathe in, breathe out. You're always doing the breathing, and slowly you can raise your body way high up and stays high up. Stop about 30 seconds, a minute. Wonderful sign of healthy living. And also when you get in and out of an asana pose, do it slowly and gradually. You can all do these things sitting in a chair in a modified version. What we do for the people who just started, we actually go through the same technique, same procedures. We do it more supported, we do more modified, and we do it very slow. Another marker of a good physiological marker for our body and mind is called FEV1. F like a Frank, E like an elephant, V like a victory, 1. Forced expiratory volume in 1 second. Remember that the amount of air we breathe in and out normally is called tidal volume. So just about 500 cc. The amount of air we can breathe in with active inhalation, inspiratory reserve. Guess what? It's almost about 3 liters. We can breathe in about 6 times more than what we breathe in and out. We can forcefully breathe out about 1.5 liters. Expiratory reserve. So, a lung capacity is about 6 liters. 1.5 liter is called a residual volume. That volume you need to keep the lung open. But 4.5 liter you can exchange, called vital capacity. So the technique is, you breathe out first, you take a deep breath in, and breathe out forcibly in 1 second. If you get more than 1 liter out, 1.5 liters, 1.5 liters is an excellent physiological marker. When I go for pulmonary function test, they have their own parameters, but I break off the parameters. I go the highest and I say, just set it up a little higher for me. So, this is your FEV1 for healthy living and sign of health. Breathe out first. Many physiologists also uses both through the nose and the mouth. Remember, you always breathe in through your nose. You don't breathe in through your mouth. If you breathe in through your mouth, you have no idea where the air has gone. You need to have the air through your nose. But physiologically, if you cannot breathe all through your nostril, you can breathe out through your mouth. So the same thing will be like this. Breathing out first, take a deep breath in, breathe out through your nose and mouth in 1 second. FEV1. Practice it. It's a wonderful practice. We always keep this again, physiological parameter, as most of you know this. These days, this is an Apple Watch becoming a marker of your health parameters. It records EKG, continuously records an EKG, heart rate, everything, your all parameters. So the next one is very important, a sign of health is able to sit down in a squatting pose. When you're able to sit in a squatting pose, that is a sign of your health. Because it's a relaxation response. Look at this. With this, my ankle is relaxed, my knee is relaxed, my hip is relaxed, back is relaxed, even my hand. If you put your hand, separate your fingers, your hand gets relaxed. Put your elbows in, keep your spine straight, slowly bring your hand close to you, close your eyes, breathe in and out. There cannot be a marker better than this health. Squatting pose, Malasana. Another powerful sign of your health is your Thunderbolt Vajrasana. So when you do the Thunderbolt, remember, people always get into thunder. So you go in stages. Maybe you first able to sit down on a hill. It'll be easier for you to do. And always keep your spine straight. If you have an issue, you can put a little roller under it, or you can roll your mat and put it there. And slowly drop your feet down. And keep your spine straight. If you have an issue, you can put a little bit of a pillow underneath your hips. Wonderful asana because it is activation of your parasympathetic tone and activation of your digestive process. Another powerful tool of your health is from your squatting pose, you're able to get up without a support. And this is your regular routine practice. And you do it regularly to improve your health and healing. Remember, the worst thing what we have is a truncal obesity. So you're able to sit down and able to get up. No support. Okay? And people all say, oh, I'm old, I'm 70, I'm 75, I'm 80. Age is a number, chronological age. But the most important age is your physiological age, mental age. Another powerful sign of health and healing, healthy living, is able to get up without a support. Let me show it to you. You sit down completely in your ground. Cross your feet. From here, you will try to get up without a support. Let's see. If you're doing with me, give it a try. Sit down from here, see if you can get up without a support. Sign of health, healthy living. Balance it. If you're putting your feet, cross it other side. Cross your feet on other side. Sit down. If you use your one hand to get up, you lose 25% of your health. Put two hands, you lose 50% of your health. 2 hands and a foot, you need 70% of your health. Simply, here, comfortably, sit down and get up without a support. Practice it. So, all healthy living in life is yoga as a therapy. When you're able to do this, you'll enjoy every moment of your life. You look at a flower, you'll enjoy the fragrance of a flower. You're comfortable standing like this, feet separated. Bring the balance back. Balance is a sign of health. So, put your feet together. See how you feel. It'll be a little uncomfortable initially, but slowly and slowly, this will be your normal, regular posture. Most important posture will be for you from here is that your ear, your shoulder, your hip, and your ankle will be in a straight line. So there is and you will feel like you are a stick. Dandasana, Jastyasana. In yogic tradition it says, when a seer becomes sin, that's a sign of health, sign of balance, sign of yoga. I'm doing a tree pose. And I look at the tree outside, and slowly I became the tree. A seer becomes sin. Drashta যখন দৃষ্টি হয়. When drashta দৃষ্টি হয়, that is your sign of your health. So the story or the joke is that a yogi who was walking with a stick. Remember, his body, he felt like a stick. So came home, unconsciously he put the stick on his bed, and he went next to the door, and he stood up there whole night, and he slept, standing up. Because on his mind, he was the stick. So, able to sit down on a squatting pose is a asana for proper elimination. You can do a massaging in your abdomen, moving all the contents down. I'll show you these asanas. There are 5 asanas which are called your intestinal cleansing. The first one is called upward mountain pose, Uttanasana. Keep your body straight, take your hands, clasp your hands, put it over your head, and when with your breathing, you do a balancing pose. Like you breathe out first, take a deep breath in, slowly get to tippy toes, and your hands will go higher. And able to stay here. Tippy toes, hand goes high up with the breathing. You breathe in, breathe out. If you do Tirjaktarasana, oblique mountain pose, put your in the head, or you can do high up. Breathe out first, take a deep breath in, slowly turn your body on one side. and slowly come back into the center. Opposite side, breathe out first, deep breath in, and slowly go to the opposite side. What is very important when you practice, you do it a little longer, more times. What is very important is exercise is a muscle contraction, and every asana you do, you'll be able to do faster enough that it will act like good exercise. Difference between exercise and yoga is exercise is a muscle contraction. Exercise is sympathetic. Exercise raises your heart rate, your blood pressure, respiratory rate. Then your body's homeostasis comes in and body starts a parasympathetic activation. So pulse rate comes down, the breathing becomes better. In yoga practice, it is a primary activation of parasympathetic tone. You get some saliva in your mouth when you're practicing yoga. Very important observation. West rotation is a very important yogic sign of health. So you do it very gently. It's called Kati Chakrasana. If you're doing with me, separate your feet a little bit. The hands on both sides. Put your left hand to the back, right hand over your left shoulder. Always breathe out first. Take a deep breath in. Slowly turn your body all the way to the back as much as you can do. And slowly it will come back here. Same thing on the opposite side. This time, right hand goes to the back, left hand over your right shoulder. Breathe out first, take a deep breath in, slowly turn your body all the way to the back. Able to stay and hold in the pose a longer and longer time. I'm just showing you the technique. If you're practicing at home, you do it a little more. It helps you proper elimination. You can always do it. It's also like I call it moving meditation. Put your hands in front, do with your breathing, with your eyes closed. Like here, breathe out first. Take a deep breath in, and breathing out, slowly rotate your body all the way to the back. And in the same breathing cycle, come back into the middle. That's how you extend your exhalation. Breathe in here and breathe out all the way to the back. Finally, a meditative. This is called a moving meditation. Close your eyes. Follow your breath and do it very gently. But following your breath, eyes closed. Able to incorporate Bhastrika Pranayama with your active yogic practice. For the yogis, they don't have any gym. They used to do called push-up and sit-ups. Their push-up and sit-ups with your breathing was the strength and stamina and the healthy living. The way they used to do it, so suppose the simple sit-ups they will do, they'll have a breathe in, so you got the concept, the active breathing, breathing out. Sadharan Baitak, simple squatting pose. Palwani Baitak, when you do it, little bit of a faster exhalation, like you do 3 times exhalation with 1 inhalation. You do like this. Continue that. You'll see the difference it makes in your body and mind. Hanuman Baitak, very important Hanuman Baitak, because in a Hanuman Baitak, Hanuman is the yogi, it gives you knee joint and hip joint health. We have so many people with a knee problem, hip problem, the largest number of knee replacement and hip replacement is done. This is the practice. We nickname it. It is permanent knee joint and hip joint replacement. So, the hands in front. So slowly you'll go down. Slowly go all the way down, all the way high up. Go to the opposite side, all the way down. Slowly you go down, all the way you go higher. Can you imagine getting a knee joint replacement, a hip joint replacement? So the other way around. Turn your right foot out. Hand in the waist, go all the way down, all the way high up. Opposite side. Head below your heart is a practice to activate your homeostasis. Remember, we have in our brain area is called the default mode network. Default mode. What is the default mode? When your electronics doesn't work, computer doesn't work, cell phone doesn't work, laptop doesn't work, a default setting. Default setting is the manufacturer's setting. Anything you do your body always brings you back to your normal. Default mode network. So you put your head down, your pressure inside the brain goes high up, pressure inside the eyes goes high up, pressure inside the carotid arteries goes high up, and you feel miserable. But if you keep it down slowly, initially your head will get flushed, you will have tear comes out from your eyes, but slowly and slowly you will see that homeostasis. Remember, healing and health is the restoration of homeostasis. Homeostasis is limbic system, hypothalamus, pituitary adrenal axis, psychoneuroendocrinology, psychoneuroimmunology. These are the words for healthcare providers, and you understand. So, let's show you slowly how you can put your head down. You can head down slowly, support your hand, support it, put your head down, and see where you are. If you feel any effort in breathing, get up slowly. Or you can find a place where the breathing normalizes, you don't have any pain in the body, you keep coming down. And you keep on separating your feet. This is called your widespread head touching your knees, or Prasarita Uttanasana, forward bend. See, I have spread my feet all the way. This is also called your, we come to the middle a little bit so you can be able to see better. This is also called your split Hanumanasana. Then slowly you can come down, your head all the way down. You hold your one ankle, other ankle, and you are relaxed enough. You can do a Kapalbhati Pranayama. It's a wonderful activation of your homeostatic mechanism and activation of your baroreceptors. The receptors in our blood vessels called baroreceptors, which gets more sensitive. So any changes in the body, any changes in your blood pressure, any changes in your heart rate, body will control it. For all of our cardiovascular disorders, we treat people with a beta blocker, ACE inhibitor, aspirin and statin. If you look at the physiological changes of all the yoga practices, you'll be surprised to see they have the same effect of a beta blocker, ACE inhibitor, even aspirin and statin. I teach a course called Yoga Therapy for Cardiovascular Disorder, and that's what I teach. Shankhasana, Udarkarshanasana. Abdomen, part of your proper elimination. Put your hand on both the knees. Right knee comes in front of your left foot. Left knee goes to the right. Take a deep breath in. Turn your body to the opposite side. Slowly come back high up. Put your left knee in front. This is your Shankhasana or Udarkarshan Asana. Push your right knee to the left side, spine straight, and breathe out first. Take a deep breath in, slowly turn your body away from you. So this is the fourth asana. Upward mountain pose, oblique mountain pose, west rotation pose, and this is abdominal churning asana. Next one, all the laying down asanas. The one for proper elimination is called your oblique cobra pose. This is a simple cobra pose we call bhujangasana. The moment you do bhujangasana, you put your face down. You can see me, yes. Normally, in a cobra pose, you put your hands, feet together. You relax a little bit. You're in Markarasana, hands on both sides. There's a lot of nice relaxing asanas. Separate your feet up to the width of the mat. Hands on both sides. Body slowly goes high up. And over the left shoulder, you look at your right foot. You do the same thing again. Body goes high up. Over the right shoulder, look into the left foot. Tirjak Bhujanga Asana. This is your healthy living, able to sit down in a Thunderbolt Vajrasana. Powerful activator of your parasympathetic tone and digestion. After a big meal, sit down like this. Proper digestion, activation of your digestive fire, called Agni Deepan. Deepan means ignite. Ignite the fire within your stomach. Remember, we eat food. The food goes into the stomach. Our stomach has this stove top. Food gets cooked there. So, 5 or 6 asanas laying down. Remember, the whole action is in the abdomen. In yoga says, if you massage the area, it becomes more healthier and more in balance. So we will be doing the few asanas you will see, all centered towards our belly button, and then we'll show you how to sleep. When you're laying down, all the way straight to lay down, the feet together. Initially, hands on both sides, palm facing high up, and your chin try to be as low as possible. If your chin is too high up, it is sympathetic. You like to put a little bit of a pillow or something under your head so that you're unconsciously do this. When you relax a little bit more, like when you'll be doing a little bit more, better show you what are the asanas and practices we need to go to sleep. You will be separating your feet. To ignite your Agni and also to control your truncal obesity, the first asana is your feet raising. Padavuttarasana, feet raising. From here, you can do your boat pose. You can go in your boat and stay in the boat pose. Stay as long as you can for a boat pose. Feet raising pose. What pose? Asana. Knee chest, Pavan Muktasana. Hold your both knees. You can rest here. Slowly touch your nose to the knee. In fact, your chin goes in front of your knee. And relax enough. You do a little side to side movement. And also you can do front and back. All the way to the back, all the way to the front. Do it a little longer when you're at home, when you're practicing yourself. Spinal twist. One is called, Sanskrit name is called Jathar Parivartanasana. Jathar is your stomach, Parivartan is revolving. Or called Merudan Sanchalanasana. Moving your spine, hands on both sides, your feet together, put both the knees on the right side and turn your head to look in your left hand. Able to stay in this posture, able to stay here longer and longer, you will be relaxed enough that you will be able to even sleep in this posture. You will see a lot of babies sleep like this. We'll do the same thing again in the opposite side. Both the knees will come to the left side and you look into the right hand. Same asana you can do, a little bit more advanced. You can raise both the feet high up, drop both the feet down to touch your right hand, and then turn your head to look into your left hand. Same thing you do in opposite side. Both the feet come, left hand, and look at the right hand. These are all your improving your digestive fire. Jathar Parivartan Asana. Bridge pose, Setuban Sarvangasana. Bend your knees up to the width of your shoulder. Touch the back of your heel with your fingers. Slowly raise your body high up, hands down, and body will go high up very easily. When you get into the proper bridge pose, and raise one foot high up and able to stay in the pose. Drop it down, the other foot high up, and stay in the pose. Slowly come down. Feet touching your nose and the forehead. Big Sanskrit name, Padanguli Nashasporshasana. Padanguli means toes, touching the tip of your nose. Take your feet, so slowly it will touch your nose and then touch your forehead. Follow Bastrika Asana. Feet touching your forehead. You can do the other side. Bring it up. Touch your big toe to your nose. Then up your foot. Finally, you can do both the feet. Hold both the feet. Bring it up.